For the better part of 2 decades, there's been a growing recognition that medical errors kill too many patients in the U.S. While exact numbers are elusive, a new analysis and estimate portrays an even grimmer picture. The new paper finds that as many as 250,000 people die each year from errors in hospitals and other healthcare facilities. That would make it the third leading cause of death in the U.S., ahead of respiratory disease, accidents, and even stroke.
Good evening, friends. We start tonight with a very important story, a story that affects every American when you, a friend, or a loved one goes to the doctor. Do you know how good your doctor is? These stories seem to come right out of a medical TV drama. Doctors operate on the wrong body part, or the wrong patient gets the wrong medicine, but these errors are becoming a scary reality in America. The medical journal BMJ says medical error kills more than 250,000 Americans every year. Medical error is now the third leading cause of deaths in the United States. The Centers for Disease Control says heart disease kills the most Americans, with the number at 600,000 per year. Second is cancer, and third, respiratory diseases such as emphysema and bronchitis. That number is at 150,000. Medical error causes more deaths in the United States than strokes, car crashes, Alzheimer's, diabetes, and suicide, and the list goes on. And it means more than 1 in 10 deaths each year in this country are caused by medical error. But the CDC does not list medical error as a cause of death. So where's the accountability? Earlier today, I spoke with Dr. Martin McCray, who led the research on deaths by medical error.
A study published this week by researchers at the Johns Hopkins University School of Medicine claims that medical errors in healthcare facilities may now be the third leading cause of death in the United States. The study published in the BMJ shows how patients are dying from the care they are receiving and not the ailments which they are seeking treatment, with 251,000 people dying annually. Those numbers exceed those deaths related to accidents, stroke, Alzheimer's, and respiratory disease. Currently, heart disease and cancer lead in the number of deaths in the United States. Researchers part of the study say the causes are a wide spectrum, from bad doctors to communication problems due to patients moving from one department to another, and think healthcare facilities need to stop avoiding the topic. Allegedly, the Centers for Disease Control and Prevention do not require reporting of errors in data it collects regarding deaths through billing codes, which aids in keeping this type of information from the public. For Health and Wellness, thanks for watching.
Doctor, you hit on the third leading cause of death in the United States, and I'm sure most of us could figure it's either heart-related or cancer or diabetes, things like that. Can you clue us into what that is and why?
The American Medical Association is MD-directed treatments. This means you go to a medical doctor, an MD, he gives you a treatment and you die from it. According to the United States Department of Health and Human Services, 15,000 Medicare patients a month are killed by MD treatment, and nobody goes to jail. A handful of terrorists fly 2 planes into the Twin Towers. 3,500 people die, and we go to war. But 15,000 people a month are killed by medical doctor treatments, and we don't bat an eyelash. This is because we have been, I don't want to say brainwashed, that's not the correct term, but we have been, for the last 100 years, kind of led into this false belief. You know, I think it was Marcus Welby that started it, that the medical doctor is king and knows everything about everything. And really, you need to just shut up and follow your medical doctor's advice. Most people in the United States have no idea at all of the history of the evolution of medicine in the United States. In the early 1900s, it was a relatively level playing field between the chiropractors, the osteopaths, the homeopaths, and the MDs. In 1915, 1920, there was something called the Flexner Report. The Carnegie Corporation funded this man named Abraham Flexner. He went all around the country, and he went on stagecoach and train and horseback. This was before the interstate highway system, right? It took Flexner 5 years to do this. He went all around the country and did an inventory of all of the medical schools that prescribe drugs. He brought the list back to the Carnegies, who own drug companies, and then the Carnegies and the Rockefellers gave millions of dollars of free money to the medical schools and hospitals in the United States that were prescribing drugs. That was the beginning of the end. After the Flexner Report, there was no more level playing field in the United States. And the MDs started a juggernaut that's taken off. Most people in the United States think that the predominant medicine here, MD-directed pharmaceutical medicine, we think that those guys are top dog because their therapeutics are better than the homeopaths or the naturopaths or the chiropractors. It's not. They're in the driver's seat because of political and financial coalitions that were built at the turn of the century that most people have no idea of at all. And it's a gigantic problem. And I mean, it's crazy, right? It's the third leading cause of death. And yet, when the government makes noise about messing with people's insurance, everybody freaks out. And that's a whole other thing to talk about, isn't it? Because what is medical insurance? When you buy medical insurance, what are you doing? You're betting that you're going to get so sick you will not be able to afford it. Right?
Yeah.
Right. And then, so you pay good money every month to gain access to a system of medicine that's the third leading cause of death in the United States. I mean, people, I come to my lectures and they look at me and say, couch potatoes live longer? Medical doctors are the third leading cause of death? You know, what's going on here? We're like the people, you know, in Galileo's time saying, hey, everybody, you know, it's the sun that's at the center of the solar system, not the Earth. Well, hey, everybody, the Earth is round, it's not flat. We have a social agenda here. Why do we have a social agenda? Because people are suffering needlessly. You wouldn't believe, as God is my witness, you would not believe the things that I've seen people recover from. The body's ability to fix itself is remarkable. And most of the time, all that the body needs to do that is the raw materials that it needs to do that. And we need to stop eating food that's hurting the body. You know, if you put diesel fuel in an unleaded engine, even if it's a brand new Ferrari, it's going to run like crap if it runs at all. And there's nothing wrong with the car, it just had the wrong fuel. It's the same with the human body. You give the human body the raw materials that it needs, clean up the diet, Superman, Superwoman. And you know, if you don't get to super status, then at least your blood pressure normalizes, at least your arthritis goes away, at least your anxiety and panic attacks go away, and you can sleep through the night.